Healthcare is one of the largest industries in the world, and the utilization of blockchain within the industry will help make it a smarter and more efficient system. With the $971.8 billion industry value and more than 20 million users, the cost of administrative errors is too high. Healthcare involves the patient, provider of care, insurer, and the government. 4 separate entities means that there is a lot of data. In fact, this overwhelming amount of data and interoperability oftentimes causes discrepancies between the shareholders of data. For example, patient medical records can vary between providers, or insurance claims can get denied due to inaccuracy of providers' records. The industry is based on trust. Will the doctor prescribe and treat the patient effectively? Or on the contrary, can the healthcare professional trust the patient is honestly sharing their experiences or conditions with them? To ensure this trust is upheld, a system is needed to ensure secure data sharing, one like blockchain. But before we dive into the application of blockchain to the industry, what is blockchain?
Blockchain is essentially a shared database across a network of computers that allows information to be distributed and not copied. The blockchain database is decentralized, allowing for peer-to-peer evaluation of material. The database functions as a chain made up of records, using previous blocks as verification for the next block. This makes blockchain extremely secure because once a record is shared, it is impossible to alter the records. Only new information can be added to the chain. Before the block can be added to the chain, the network must approve the record's validity.
Why is the chain so hard to change? Any change to the original input will alter the hash. This causes a discrepancy between the block and its precedent, because the next block still has the original hash. To restore the change, a hacker would have to recompute all the hashes, which would take enormous computing power, resulting in an effort more costly than any benefit gained from changing the data. There are 2 types of blockchain: permissionless and permission blockchain. Permissionless blockchain allows for anyone to join and contribute to the ledger, an example of which is Bitcoin, while permission blockchain only allows those specifically chosen to have access, which is important to the healthcare industry since it is focused on security.
Because it's so difficult to tamper with and allows for secure distribution of information, blockchain brings substantial benefits to the healthcare industry. Blockchain will tie together the complex team composed of the patient, provider, insurer, and payment associated with the care. It will allow for better data sharing between healthcare providers, ultimately increasing the probability of a more accurate diagnosis and treatment. Smart contracts can be added to the chain, allowing for solidified agreements between patients, providers, and insurance companies. And with this comes increased transparency and automation. Also, administration costs will lower, while efficiency will increase substantially. Blockchain in the healthcare industry would diminish any disparities between medical records, allow for fluid tracking of billing, and mitigate the hustle and bustle between the major entities, resulting in a streamlined system for all.
But blockchain is not solely applicable to the healthcare industry. In fact, blockchain is the backbone for cryptocurrency and could revolutionize the way we see and understand the world today. Another example of its use is how IBM and Maersk partnered to create an industry-wide digital ledger to streamline the supply chain of the shipping industry. Blockchain could be used to prove property ownership, secure voting processes, and remove the middleman from transactions in banking and so much more. Blockchain is the future of business, and healthcare is just one of many examples.
Healthcare is one of